Hello, my name is Henning Kalwa, and I am the Temos Representative here in Southeast Asia, based in Bangkok, Thailand. And today I have the great opportunity to be speaking with Dr. Asaad and to see what what change Temos is doing in Egypt and in the region, and what else is going on in the Temos universe. Dear Dr. Asaad, can you briefly introduce yourself to our audience and tell us about your role as a Temos representative in your region?
Thank you, Mr. Henning, for this interesting interview. I would like actually to thank you for your time, for your introduction. From my side, I'm actually a consultant radiologist, a medical doctor, but not practicing for some time because now I am managing a company for medical travel assistance in the region in Egypt. And I represent Temos since 2017 as a regional partner regional office manager in Egypt. And currently, I also expanded to North Africa and maybe also other parts of the Africa because we still have a lot to do in these countries. In addition to my role as an assessor and lead assessor with Temos, but as you know about the conflict of interest, I can't have the two hats in the same country. So I have to do the assessment outside Egypt to get, first of all, more experience internationally, but not to have some BAs here or there inside the country. At 2000, I think 23, I also have another hat as an instructor with the educational arm of Temos, which is Temos Academy, which I like also to spread the knowledge and awareness of Temos to many, many other colleagues and partners in our region.
Well, indeed, Dr. Asaad, you're a man wearing many different hats. And I think you already pointed out a couple of specific Temos advantages. Just like you said, a single person not being to promote Temos accreditation and then also being the person that accredits that provider, which is very important. So, on that note, from your perspective, what makes Temos different from other accreditation companies? And why is this especially relevant for healthcare providers in your region or the regions you just mentioned?
Yeah, a good question. I don't have to be biased from my side, but this is the real reason why I decided at certain time of my life to join Temos and to promote Temos to healthcare providers in Egypt. First of all, Temos is an internationally well-known and have a good reputation in healthcare accreditation. The second point, which is very important for me, that it has a unique, let us say, part of their standards, not only focusing on the medical and clinical care, which is common for all the international accreditations. But what I liked more at that time, especially that I am working with international patients since 2007 in medical travel assistance company, that it has a non-clinical also standards. They are not only focusing on medical nursing safety, which is by default it is present, but to add also some points of ethical, legal, accounting, and even something was unique about sustainability at that time. This was very interesting for me that finally I find something unique, something which people in healthcare field doesn't think about, which for me could be like an added value for the healthcare providers in our region, which proved day after day when we have more customers that they think that we didn't know about that. We have no idea about that. This is something makes me happy that we open some channels for them to think about what they can do, how they can proceed, how they can think internationally, not only locally inside the walls of the hospital or the clinic.
Very good. Thank you very much for this fantastic overview of some more unique benefits of Temos accreditation. I'd like to ask you, what are some of the key challenges healthcare providers in your region face, and how does Temos help them overcome these?
Okay, this is also a good question, especially with the vision of Egypt and their approach to have Egypt as a health tourism destination. First of all, this makes some challenges for them. It means that we know that most of the medium-sized and small-sized medical facilities are managed by their owner, by single owner or a family business or similar. So they all the time they think that everything is going well as long as we don't have big problems happen. It means for them that they are good. But when you think that we have another eye coming from Temos assessors who have experience collectively as more than 100 countries experience here and there. Now they started to discover that there is something, I will not say wrong, but something needs to be improved. So when we shared some experience from here and there, they are first of all happy to know, then another alarm for them that this part is not as good as you think. It means that we need something here to make more and continuous improvement in this way. Sometimes you are not listening to your community, but when you have somebody comes, and this is another part of the power of Temos, that the assessors of Temos are coming with more experience internationally. And when they share ideas, when they share experience here and there, not only in Egypt. I'm coming from Egypt, and when I visit another country outside, I also share some experience to another country. So this is makes an increase and improvement of the culture of the healthcare inside the medical facility or hospital, and at the end, like a benefit for a patient, which is our target at the end.
Yeah, I can only underline what you just said. If a provider wants to pursue a medical tourism accreditation, a healthcare accreditation, it only makes sense to have international assessors to come in, right? I'm based here in Bangkok, and the hospitals want to be specialized in treating Arabic patients, European patients, patients from Australia. So it only makes sense to have a very international team to come in to make this assessment on the ground and help these providers to be ready.
If you allow me also to add something about Temos, that it has a certain standards for the culture diversity, and they insist, if we can say insist, about training of the staff on this culture diversity. How the doctors, nursing, even housekeeping, employees, reception, international patients know the real need of patient. I always say that patient doesn't know medicine, doesn't know how doctor is efficient or not. They don't know about the difference between CT and MRI machine, but they know how meet me, how you introduce yourself, how you smile when you are meeting me in the reception, how you handle and finish my procedures fast, how you shake hands with me or greets me when you meet me, and when you say goodbye when I finish and leave. This is also a good part that I like in Temos' focus in healthcare.
Needless to say, the international patients and local patients benefit if the provider is accredited. Can you share examples of tangible or non-tangible benefits providers have experienced after obtaining Temos accreditation?
I live in Hurghada in Red Sea area, where we have the most touristic city in Egypt, has more than maybe 400 hotels and resorts on the governorate. When we have started with 2 hospitals in 2017, the term of international accreditation at that time was unique, strange for them. They don't accept it easily, and they consider it challenging. Why we have to go for international? People are coming already. They are in emergency and they find hospital and they come. And then they started. And then they started to read the standards and try to apply it. In the first cycle, this was really, and I felt sad because I visited them many times at that time. It's challenging. Why we have to do that? After the first cycle of accreditation, which is 3 years, they were happy to renew it again. And then now it is easy. We know what is needed and we have to improve. And now with the third accreditation cycle, which just completed this year, I find that both hospitals started to put the logo of Temos outside the hospital, just beside their logo. And because they feel now that they are connected, not only on the agreement and legal issues, but emotionally even with Temos as a good partner, improving the quality of service and the repetition with the customer. This an example in Egypt. And the other one, I will not mention the country, but it happens that I went as an assessor or a lead assessor to a hospital with the one single owner. And at that time, I felt with my team that the owner saw that this is just an accreditation which we can buy. You just pay the accreditation and you get the certificate or the accreditation at the end of the 3-4 days we spend in the hospital, and that's all. But when we started to ask about some, let us say, critical standards with him, how do you have a strategic plan? He said, yes. Where is it? He said, here. Then after some time, we asked how you communicate that with the team. He started to say, we meet every day. Do you document something? Do you have something just to evaluate if you succeeded or not? Then they become stressed somehow. And I will not say a secret, they didn't pass in the first time. Although it is a big hospital in a big city in the capital of a European country and so on. So we give them some time, 6 months, and I visited them again. And after this second visit, I found a complete change of their, let us say, behavior, their mentality, their thinking, understanding of the standards. And when at the end of the second visit, I found that the medical director told me, now we know why the owner choose Temos for our accreditation. Yes, it takes some time and effort from us, but we are now changing 180 degree to understand what quality means, what the patient safety means, what is the data protection means. Also, again, as I mentioned, it is a European country, but they didn't think that this is very important.
Personally, I also feel like a Temos accreditation is more of a capstone on top on a quality and safety culture that has to be grown over time, right? So it's definitely it's connected. It's not the one or the other. It actually comes together. Temos could be the pinnacle at the end, the cherry on top that the organization then can kind of celebrate, and they can celebrate themselves. But of course, it's not the end of the road either. So it's a continuous improvement.
It is a lifetime cycle. It can't be like just to get a paper. And I always say the international accreditation is like the ruler or the international ruler that can measure your quality system. But it will not create a quality environment unless you, from deep inside, would like to have a quality system inside your.
Where do you see the greatest opportunities for healthcare providers in your region to raise their standards, and how can Temos support that journey?
Okay, it's again a fantastic questions, and I would love to answer it from my vision now in Egypt. As you know, Egypt is a touristic destination, and it has around 15 million tourists visiting it every year. And the vision now of the country is also to have some health tourism projects and branding of the country. We have now the first Health Tourism Council, the official one under the patronage of the Prime Minister. And I assume that most of the hospitals now would like to have this piece of cake of this huge project. But most of them doesn't know how to start. They think that only a good doctor, a good machine is enough, which is not the truth. You have to understand the mentality and needs of this market, how to organize and harmonize all these services together. And from my point of view as a doctor, I understand, yes, we have good doctors, we have good nursing, we have good machines, devices in the hospital, but not all of them can coordinate it in a harmonized way. Here comes the standards of Temos, that we are not as an assessors only giving some papers to the hospital to do and prepare some documents to show us. This could be done, as you know now, but by AI, and we will have a fantastic papers. But the assessors are evaluating that by talking to each process owner individually. And at the same time, we are tracing that inside the hospital. We are living in the hospital for 3 or 4 days to evaluate what is going on. Even we are testing the patient food. We are testing the light and sound inside the patient room. We are meeting the receptionist. We are meeting the facility management, biomedical engineering. We have to be, let us say, realized or satisfied about the quality system inside. This is a really challenge of a hospital which does not have a healthcare quality system at all. If they start from zero or under zero, they need somebody to support. This is why we have a lot now of Temos consultants got courses from Temos Academy, so they are ready to support and help healthcare providers. We have also Temos Academy arm, which provide also courses to those who are interested to go for either healthcare accreditation or even for the international patient management. At the same time, we gave the online tools to healthcare providers not to leave them alone. If they would like to do the job by themselves, they can do it. It is simple. Some people, by the way, think that we have an international accreditation and it is from Germany. It should be very difficult. No, it is not like this. We have the tools they can read, just to have to imply or to provide the evidence for that. And then even we have what we can say is a pre-test that you can evaluate yourself before you ask the assessors to come and visit your hospital. So we are supporting them hand by hand. We have a lot of people on site here, including myself, and we have the online support in case they need some support from the headquarters.
Final question, Dr. Asaad. What message would you like to share with healthcare leaders who are considering accreditation but haven't yet taken the first step?
Okay, this is also a very sensitive question. Some people comes to me and ask, do we have to go for accreditation or international accreditation or not? It deserves to pay this amount of money or not? And we know the challenging point now regarding the exchange rate and similar. But I would like to pass this clear message to them. First of all, you are saving by going internationally with the international standards. I mean that you are closing a lot of gap, that you are losing money where you don't realize that this happens. But when an assessor come from outside telling you, here you are losing money, here you are losing money, here is the something with the patient waiting time, or because you are having a problem with this process or this device or this machine. And that's the second point, that the international accreditation is like an asset. You are investing in passing the information to the whole world that you deserve a trust. You can't get my opinion, for example, about a factory. I am not an engineer. I don't know about it. But when you send people from international vision, we have, by the way, different category of assessor. We have doctors, we have nursing, we have biomedical engineering, we have qualiticians, we have a lot of different prospects coming to your hospital for auditing. And when they say that your hospital deserves an international seal or accreditation, it means a lot. So this is the goal, this is the aim. And the missing word that we usually say to our medical providers, if you would like to go to the medical tourism, you have to build the trust, you have to build the brand. And the international accreditation is a part of this story.
Dr. Asaad, thank you very much. This was very insightful. Thank you very much for your time.
Thank you for this interview. I'm happy to talk about Temos because it was like a part of my lifetime vision now, to support, to add, and to increase the awareness, which I really felt now in the Egyptian market, and hopefully soon it will be spread also to North Africa and other African countries. Thank you.
Thanks again.